The activity we're exposing the students to is aquatic rescue, which is very basic exposure to the students to show them how do you retrieve patients from the water or from a river, the different techniques needed, the boats that are used, the specialized personnel, the types of ropes, and how to build systems to get the patient out from the water safely, effectively and timelessly, so as not to delay the patient being in the water, especially during the time of the year we're doing it now. It's very cold, winter time, so the patient, the longer he's in the water, he's exposed to hypothermia, which is one of the worst medical conditions to be exposed to. So we're exposing the students to how to deal with hypothermia, and the purpose of the day is to show them how it is done also pre-hospitally. So how does the rescuers retrieve the patient safely, bring them to the shore, how the patient is handed over to the medical crew, and from there how the medical crews assess the patient, how to treat the hypothermia, how to do assessments on basic assessments, maneuvers, procedures, and to think out of the box on the treatment plan for the patient. My main expectation for them is patient treatment. How to deal with a hypothermic patient, what to look for, the clinical signs, their approach and the safety factors, how to go through the approach basically, and like I indicated, just to start the effective treatment in the end of the day. Most of the times nurses are in a controlled environment. So what we're trying to do is we are trying to expose them to an uncontrolled environment to see pre-hospitally what is the conditions, how did the paramedics or the rescuers get the patient out. So when they come into a controlled environment and they're handed over to the nursing staff or to the hospital, they can kind of look and kind of think and say, okay, the person comes from a hot water, this is what elements are, the environmental aspects in it, and what the rescuer went through and what the paramedic went through. So it just gives them a deeper insight into the treatment procedure of the patient.